Diagnosis. Guillain-Barré syndrome (GBS) can be difficult to diagnose, especially at its early stages due to its similarity in symptoms with other neurological diseases. Initial signs and symptoms can vary amongst each patient. Physicians may conduct a physical examination of feet, limbs, and hands to check symptoms like numbness. They will indicate whether the symptoms appear on both sides of the body, which is a typical finding in GBS, and the speed at which the symptoms appear. 1. Physical exam. This is commonly the initial step to diagnosing GBS and checking the symptoms of Guillain-Barré syndrome. Physicians will generally look for the following symptoms. 1. Recent onset, within days to at most 4 weeks of weakness occurring on both sides of the body, usually starting in the legs. 2. Abnormal sensations such as numbness, pain, and tingling in the feet. 2. These sensations can accompany or occur prior to weakness. 3. Deep tendon reflexes are absent or diminished in weak limbs. 2. Nerve tests. A nerve conduction study is a medical diagnostic test that is commonly used to assess the function, especially the ability of electrical conduction, of the motor and sensory nerves of the body. There are two different types of nerve tests. 1. Electromyography (EMG). In electromyography, electrical recordings and activity of the nerves are measured by inserting tiny needles into the muscles. 2. Nerve conduction studies. In nerve conduction studies, mild electric shock is given to activate the nerves and check how fast signals travel through them. In GBS, abnormal nerve conduction velocity findings, such as slow signal conduction, are usually observed. 3. Lumbar puncture. In this medical procedure, also known as a spinal tap, a needle is inserted into the spinal canal, most typically to collect cerebrospinal fluid for diagnostic testing purposes. Lumbar punctures help diagnose diseases of the central nervous system, including those of the brain and spine. Key diagnostic findings include elevated cerebrospinal fluid protein without elevated cell count. It may take up to 10 days from the onset of symptoms for this to develop. 4. Antibody tests. An antibody test on blood is done to identify if the patient has the Miller-Fisher variant of Guillain-Barré syndrome. However, there are limitations to antibody tests, and they are usually not available for identifying the more common types of Guillain-Barré syndrome. Treatment. There's no cure for Guillain-Barré syndrome. But two types of treatments can speed recovery and reduce the severity of the illness. 1. Plasma exchange, plasmapheresis. 1. The liquid portion of part of your blood, plasma, is removed and separated from your blood cells. 1. The blood cells are then put back into your body, which manufactures more plasma to make up for what was removed. 1. Plasmapheresis may work by ridding plasma of certain antibodies that contribute to the immune system's attack on the peripheral nerves. 2. Immunoglobulin therapy. 2. Immunoglobulin containing healthy antibodies from blood donors is given through a vein, intravenously. 2. High doses of immunoglobulin can block the damaging antibodies that may contribute to Guillain-Barré syndrome. These treatments are equally effective. Mixing them or administering one after the other is no more effective than using either method alone. You are also likely to be given medication to 1. Relieve pain, which can be severe. 2. Prevent blood clots, which can develop while you're immobile. People with Guillain-Barré syndrome need physical help and therapy before and during recovery. Your care may include 1. Movement of your arms and legs by caregivers before recovery, to help keep your muscles flexible and strong. 2. Physical therapy during recovery to help you cope with fatigue and regain strength and proper movement. 3. Training with adaptive devices, such as a wheelchair or braces, to give you mobility and self-care skills. Recovery. Although some people can take months and even years to recover, most people with Guillain-Barré syndrome experience this general timeline. 1. After the first signs and symptoms, the condition tends to progressively worsen for about 2 weeks. 2. Symptoms reach a plateau within 4 weeks. 3. Recovery begins, usually lasting 6 to 12 months, though for some people it could take as long as 3 years. Among adults recovering from Guillain-Barré syndrome, 1. About 80% can walk independently 6 months after diagnosis. 2. About 60% fully recover motor strength 1 year after diagnosis. 3. About 5% to 10% have very delayed and incomplete recovery. Children, who rarely develop Guillain-Barré syndrome, generally recover more completely than adults. How it spreads. How people spread GBS bacteria to others is generally unknown. However, experts know that pregnant women can pass the bacteria to their babies during delivery. Most babies who get GBS disease in the first week of life are exposed to the bacteria this way. It can be hard to figure out how babies who develop GBS disease later got the bacteria. The bacteria may have come from the mother during birth or from another source. Other people who live with someone who has GBS bacteria, including other children, are not at increased risk of getting sick.